we are going to see about diseases related to bones and joints. So we are not covering all the diseases at once in this video, but we are going to make each disease in each video. Today we are going to see about Osteogenesis Imperfecta. So what is Osteogenesis Imperfecta? To remember it in a single word, it is brittle bone, that is weak bone. The bones are more fragile and porous, so this brittle bone, that is Osteogenesis Imperfecta, is closely related to Dentinogenesis Imperfecta. So as I said before, Osteogenesis Imperfecta is brittle bone. The Dentinogenesis Imperfecta is brittle teeth, that is weak teeth. Osteogenesis Imperfecta is a milder condition affecting mesodermal tissues, and it is generally a autosomal dominant characteristic where it can also be autosomal recessive or non-hereditary type. This disease in its usual form is present at birth, but sometimes it do not arise or not recognized until the later childhood. Many infants affected with this disorder are still born and die shortly after birth. When it comes to clinical features, the main two chief clinical features of Osteogenesis Imperfecta is the bones are more fragile and porous and leads to multiple fractures due to inadequate type 1 collagen formation. Even though the fracture heals rapidly, the newly formed bone is also with same imperfect quality. Another chief clinical feature is presence of blue sclera, and the sclera are abnormally thin, where this blue sclera is also seen in osteopetrosis, fetal rickets and Marfan syndrome, and as well as in normal infants. So other common characteristics of Osteogenesis Imperfecta are deafness due to Osteogenesis Imperfecta and abnormalities in the teeth, open bite, anterior and posterior crossbite, class 3 malocclusion, impaction and ectopic teeth, an abnormal shape of the skull, tendency of the capillary bleeding, and abnormal electrical reaction of the muscle. In oral manifestation, the Osteogenesis Imperfecta is due to disturbance in the mesenchymal tissue, and it particularly disturbs the calcified formation. Therefore, it also affects dentin formation, resulting in Dentinogenesis Imperfecta. Osteogenesis Imperfecta may occur with Dentinogenesis Imperfecta, or only Dentinogenesis Imperfecta may occur without more generalized bone involvement. Radiographic features, it results in bowing, osteopenia, and angulation and deformities of the long bone, presence of multiple fractures, and presence of vermeer bones on the skull. Histologic feature, where the bone has thin corticals composed of immature spongy bone, while the trabecules of the cancellous bone are delicate with multiple fractures. Osteoblastic activity is imperfect or retarded, resulting in long bones with deficiency in thickness. The basic defects lie in the organic matrix, with failure of fetal collagen to be transferred into mature collagen, but the calcification proceeds normally. Progressive intermolecular cross-linking of adjacent collagen is also defective in this and decreased collagen fibrils diameter is also observed. No known treatment for this disease, but clinical improvement following onset of puberty in girls has been noted. If you want me to discuss any other topic, please leave it in the comment box. And do like, share and subscribe for more videos.